Assalamu alaikum everyone. Welcome back to my channel. This is Dr. Sana. Today we are going to discuss about menstrual flow patterns. So let's start. Menstrual flow patterns refer to how bleeding changes during menstrual period, including the amount, color, thickness, timing, and duration of flow. Every woman's cycle is a little different, and flow can vary with age, hormone, stress, health, pregnancy history, and lifestyle. So, common menstrual flow patterns are one, light flow. In this, only a small amount of bleeding will be there. In this case, may only need panty liners or few pad changes. Blood may appear pink, light red, or brown in color. It is common at the beginning or end of the period in teenagers, women near menopause, or in women who are using hormonal birth control pills. Number 2 is moderate or normal flow. This is typical healthy pattern of menstrual flow. It lasts about 3 to 7 days, heavier during 1 to 3 days, then gradually become lighter. Sometimes small clots can occur. Average blood loss in this type of flow is 30 to 80 ml during a cycle. Now, let's discuss about the third type. It is heavy flow. We call it as menorrhagia. Signs include soaking pads or tampons every 1 to 2 hours. Large clots are present in this type of bleeding. Bleeding may be sometimes longer than 7 days. Fatigue or dizziness from blood loss is possible. Now let's look into the possible causes of heavy bleeding. Hormonal imbalance, fibroids, adenomyosis, thyroid disorders, bleeding disorders, or copper IUDs, pregnancy related problems. These are possible causes. Now let's look into the fourth type of bleeding pattern, spotting. It is very light bleeding between periods. Can appear as brown in color, pink, or tiny red spots. The possible reasons of spotting are ovulation, hormonal shifts, stress, birth control changes, early pregnancy implantation, PCOS, or infections. Fifth pattern is irregular flow. Periods may come early or late. It skips in some months, change in heaviness of the flow in each cycle. This is the type of irregular flow. It is more common in puberty, breastfeeding, perimenopause time, PCOS, or in significant stress or weight changes. Now let's look into normal changes during period. Day 1, the typical pattern of the bleeding is fresh red bleeding. Day 2 and 3, heavy flow occurs in these days. Day 4 to 5, moderate or lighter flow. Day 6 to 7, brown or spotting stage. Now let's look into the color of the blood and its meaning. Bright red color is fresh bleeding. Dark red color is slower flow. Brown color means older blood that leaves the uterus. Pink in color, which means the blood is mixed with the cervical fluid. Orange or gray color, it indicates possible infections if accompanied by any odor. Now let's look into clots during menstruation. Small clots can be normal during heavy days. It becomes concern if the clots are larger than a quarter. Clots are present frequently, and it is associated with a severe pain or very heavy bleeding. Now let's look into when the flow patterns commonly change. Changes can appear due to puberty, pregnancy, or postpartum, breastfeeding, stress, weight gain or loss, intense exercise, hormonal conditions, aging, or perimenopause time. Now let's look into when you should seek a medical care. Consider medical evaluation if the bleeding is extremely heavy, periods stop unexpectedly, not because of pregnancy, severe pain occurs during bleeding, bleeding happens after menopause, cycle becomes suddenly very irregular, you feel weak, faint, short of breath, there is a foul smelling discharge or fever with a bleeding, then you should seek a medical attention. So that's all about today's topic. Let's stop over here today. We will come back with another topic in the next video. Thanks for watching. Assalamu alaikum wa rahmatullahi wa barakatuh.